Health Chat is sponsored by Buell Regional Health Foundation.
Equine is an equine therapy program that works on trauma. We also do educational programming and have site visits for senior living facilities and local school districts. We do trauma-focused equine-assisted psychotherapy, and what that does is traditional talk therapy that engages the upper regions of the brain is not always easy for kids or adults with trauma. So we work on bottom-up regulation of the brain through experiential interactions with the horse and the client. I'm trained by the Natural Lifemanship Institute, and trauma-focused equine-assisted psychotherapy is good for both the horse and the client. They learn to build healthy pathways from the lower regions of the brain where the trauma is harbored, and they develop those pathways up to the neocortex so they can function and think clearly in their families and interactions in society. I'm a licensed social worker, so I start with a social history, so I know what the presenting problems are and the background is, and then we work on body awareness. The client needs to understand their own feelings and sensations in the body, and then they begin to learn cues from the horses so that they can interact in both their best interest. Basically, we all have some type of traumas in our life, but when it impairs your functioning in society and within your family, we work with children that have experienced trauma in their interactions. We've worked with veterans and their families, and we like to engage the families because we teach principles, not techniques. And these principles are about what healthy relationships take in your families, in the society, and we work on those together. Kids with trauma, adults with trauma, they have trouble making requests for relationships. Relationships start with a request, and they need to learn how to put just the right amount of pressure to make sure that their requests are heard. We chose the Natural Lifemanship Institute because, again, it's based on principles, not on control and dominance. Many people feel that you have to control and dominate your horse, put them into submission, but we think people are capable of controlling themselves and horses are also capable. So we work on developing that bond and trust without control or submission. When I have children for clients, I like to involve their family because both the parents and the children need to learn these principles so that they can work together within the family. We teach our clients to use the right amount of pressure to get a response from the request they make of the horse, and increase the pressure until the horse responds, and then you release. And that is something they need to do with their family, with their parents, and parents need to do with their children. Our obstacle course is Tanner's Trail Equine Obstacle Course. Was donated by his family. Tanner was an Army veteran, and he served in Afghanistan, and he suffered from PTSD, depression and anxiety and addiction. And in his family, his mother, sister, and daughter presented us with a check to purchase these obstacles so that we can use them to help people build trust and bond.